Good day. My name is Sybrand Harris, and this is my research outline presentation. I will be investigating the epidemiological factors associated with generalized demodecosis in dogs. My supervisor is Prof. Johan Skuman, and my co-supervisor is Dr. Yolandi Rotenbach. Just a quick overview of what I will be covering in this presentation. I will be looking at the aims of the project, the objectives, the relevant hypotheses. I'll be discussing the study design, and under that, I will quickly be touching on the materials and methods. And lastly, I will be discussing the statistical analysis. The aims of the project will be to see if there is a significant association between Ehrlichia species infections and generalized demodecosis. And secondly, we'll be looking at if there are any other epidemiological factors that have a significant association with generalized demodecosis. This is a microscopical view of the Demodex parasite from a deep skin scrape. This research project will investigate risk factors associated with generalized demodecosis. The primary aim will be to investigate whether dogs that have ehrlichiosis, in whatever form, this may be acute, subclinical or chronic, are more prone to develop generalized demodecosis due to potential immune suppression and/or modulation. In this picture, you can see the Ehrlichia marula in a monocyte. Secondly, we'll be looking at the association of other factors other than Ehrlichia that can potentially play a role in immune modulation. This will be discussed in more detail later in the presentation. On the right is a picture of a fecal flotation. This becomes relevant when treating dogs with demodectic mange. Treating only for demodex might not resolve the clinical picture and relieve the clinical signs, which include severe pruritus and subsequently excessive scratching. Treating for both the disease and the underlying factor can theoretically have a better treatment outcome. The objectives of this study will be divided in primary and secondary objectives. The primary objective will be to estimate whether there is a significant association between Ehrlichia species infections and generalized demodecosis. The secondary objective will be to estimate whether there are other epidemiological factors that have a significant association with generalized demodecosis. The hypotheses under these objectives. The null hypotheses under the primary objective will be dogs with generalized demodecosis do not have higher odds of having canine ehrlichiosis. The alternative hypothesis. Dogs with generalized demodecosis have higher odds of having canine ehrlichiosis. The null hypotheses under the secondary objective. There are no epidemiological factors that have an association with generalized demodecosis. And the alternative hypothesis, there are certain epidemiological factors that have a significant association with generalized demodecosis. The study design will be a quantitative method observational case control study. The case group will be dogs with generalized demodecosis, which will be diagnosed on a deep skin scrape, and the control group will be the first dog of the next owner in line. I will discuss this in the next slide. Cases and controls will be selected by concentrated sampling at mobile points over a 2-week period in October 2020. A short sampling period is selected to decrease seasonal variability in the patients. Villages on the outskirts of the bigger community, where minimal veterinary services were available in the recent past, will be selected to erect a mobile dipping and vaccination point. The villages will be informed in advance of the service being rendered on the specific day. All these villages fall under the Tembisili-Hane municipality region. All dogs with generalized Demodecosis presented at these mobile points will be sampled after owner consent. The first dog of the next owner in the queue will be sampled as the control. Dogs that present clinically with what is suspected to be generalized Demodecosis will be confirmed with several deep skin scrapes. According to Shipston in an article that was published in 2000, generalized Demodecosis is defined as any of the following: 5 or more areas of localized disease, pododemodecosis in which 2 or more feet are affected, and where an entire body region is affected. A data capturing sheet will be completed to record all samples to be taken in the control and the case group. Blood will be drawn in a serum tube for a minor medical profile and in 2 EDTA tubes, one for a complete blood count and the other one for a reverse line blot for blood-borne parasites. White blood cell lines, thrombocytes, and globulins will be used as a measure of immunity in these patients. Ehrlichia PCR will be used to investigate the first objective. For the second objective, hematocrit, total protein, albumin, fecal egg counts, and other blood parasite PCR status, like Babesia, will be used as other factors. For the statistical analysis, a 2x2 contingency table will be used to calculate the odds ratio with a 95% confidence interval. This will be used to provide the measure of strength of association. Here is an example of a 2x2 contingency table. This table will be used for each factor under investigation, and the strength of association of each factor will be determined against the disease, generalized Demodecosis. Thank you very much for your time and attention.